Today, we're going to be covering about 3 or 4 different policies that the Trump administration has passed via executive order or through other policy means. So, the first one that we're going to talk about here is Trump ordering defunding of schools and universities that mandate COVID vaccines. So, on Valentine's Day, Trump signed an executive order prohibiting federal funds from going to K through 12 schools and universities that require COVID-19 vaccinations, with the stated goal of ending coercive COVID-19 mandates. Now, USA Today is claiming that no states currently require COVID-19 vaccinations for students at K through 12 public schools, and at least 21 states have passed laws banning vaccine mandates. But the difference here is that while the states don't require it, schools are able to set their own requirements. And the thing is, vaccine requirements are not unusual. Remember, we all had to have proof of vaccination when we were attending college, and when we were attending elementary school and high school, we had to have proof of vaccination to make sure that we were protected with things like the MMR vaccine, measles, mumps, and rubella, hepatitis A, hepatitis B, things like that. So it's not unusual to have a COVID-19 vaccine in this required list of vaccines that people have to get before attending school, because you can be around and exposed to a lot of people. And if someone gets sick, then that spreads rapidly through the school, and it becomes even more widespread and even worse if people aren't vaccinated. So this is why we need to vaccinate large populations. Now, what is going to be the impact of this type of change, of this type of executive order? So if we scroll down to the COVID-19 in the respiratory index tracker, we see that there are elevated numbers of emergency department visits in young children for COVID. So by basically disincentivizing parents to get their kids vaccinated against COVID, you're elevating this risk for these young children to get a more severe course of the disease. Furthermore, if we look at these statistics, so for children under 18, which would be largely this population that is impacted, there's only, about 12% of all children under 18 have gotten the COVID vaccine, the most recent COVID vaccine, the 2024-2025 COVID vaccine. And so as a little misinformation dispelling, so people think that, if I got the first COVID vaccine or the first 2 COVID vaccines, basically your primary and your secondary of the original COVID vaccine, then you're all set to go. Well, no, because COVID variants have evolved further and further away, such that, here, let me show you real quick. So originally, back in late 2019, early 2020, we had very few COVID variants out there in existence. So when we had the COVID vaccines come out, we only had a couple of basically different major groupings of the COVID variants. There are tons and tons within each grouping, but there wasn't that much genetic drift between them, so the vaccines were pretty good. But as time has progressed, there have become more and more clades. That's why you're hearing about all these different numbers and letters combinations, like KP3.1.1, XEC, JN1, all these different combinations, and the ones you should be hearing right now are LP8.1, LP8.1.1. But for a lot of people, those are just numbers and letters. But if you look at the huge spread here, this is how diverse different variants are. So if we get a COVID vaccine protection against one, which is KP2, which is going to be over here somewhere, then KP2, KP3.101 subvariants and things like that are going to be drifting further and further away, so the vaccine is not going to be as protective against these other variants. It's going to have an immune escape, which is why we have to keep updating and getting new COVID vaccines every single year, and ideally we would get it more frequently than once a year, because the vaccine protection really only lasts for about 3 to 4 months for the active immunity. The memory immunity lasts much longer, but the active immunity is really only good for 3 to 4 months, even less in immunocompromised people. So if you got the vaccine way back in around late 2020, early 2021 when they became available, well, look how much drift there is from way back when to now. There's a lot. So you're basically going to have zero protection. If you've not stayed up to date on your COVID vaccines, you're going to have very little protection. We're finding that infection does not confer long-lasting protection, that it's basically you get very focused, specific protection against what you were infected with, but it doesn't give you broad protection against the other variants. So if you got like infected with XEC recently, it's not really going to protect you against one of these KP3.1.1 variants. So that's why we have to keep formulating new and reformulating new vaccines by just basically switching out the genetic code for a more recent COVID variant spike protein. And this is why it's really important to keep getting vaccinated. So by having this measure, you're basically creating a more susceptible population to getting infected with COVID because we are not having this sustained level of COVID vaccination. Even in adults, the percentage is only about 23% of all eligible adults have gotten the COVID vaccine within the US. That's very, very few. And this number is just going to go down. Because a lot of parents will tie their vaccinations, getting their vaccines, with their children. So they'll take their children and they'll be like, well, I'm here anyways, I might as well get my flu and my COVID vaccines, maybe their RSV vaccines if they're old enough. So this is why it's so important, and these are the fallout consequences of such decisions. So now we have to take what we just learned about the executive order from February 14th, Valentine's Day, and tie it in with further actions that the administration is taking. So the second one is that they're halting vaccine ad campaigns, specifically the wild to mild advertising that was happening for encouraging people to vaccinate against the flu and for COVID. So that's one thing. And then the next thing is that the CDC is suspending their advisory committee on immunization practices, where all three of these things are interrelated to establish a pattern of behaviors by this administration. Now, the reason for the pause to the ad campaign is that RFK wants to promote the idea of informed consent because he's very against vaccines. During his testimony, he's like, oh, I'm not against vaccines at all. I think people should make the best decision possible. But like, if you look at his history over the past however many years, he is always against it. He's always saying vaccines are bad, they hurt people, they harm people, there's risks. And he just overstates these risks and says that they're bad for everybody. And it's just not true. It's simply false. So what RFK Jr. is saying is that he wants to push an informed consent principle so that people should be notified of all the risks as well as benefits of any medical intervention they receive or any drug they are prescribed. And this might sound all good and dandy, but like this already happens. It's already being communicated. Any risks are communicated to the public, and the FDA gets involved and they say like, hey, no, this is having this one unintended consequence, sort of like the AstraZeneca vaccine from J&J. It was saying like, oh, we're getting this very rare instance of thrombocytopenia, so we're going to pause this, investigate further, and that ended up eventually just getting that whole vaccine pushed out of the market because of this finding, and it was deemed unsafe. It fluctuated back and forth here and there, but ultimately that's what happened, and that's the direct consequence of it no longer being in the markets. So we already have all these things set up. So we already have these things that are communicating to the public, hey, these are the benefits, these are the risks, and we have committees like the ACIP, the Advisory Committee on Immunization Practices, that has professionals that meet and decide the vaccine scheduling for people who should receive the vaccines and how frequently they should be receiving these vaccines. And you might be thinking, oh, that's great, they pause this committee for ACIP, which is going to stop COVID vaccination. But if we go and look at what is actually included in ACIP, I've always focused on ACIP just for COVID because that's what I'm the most interested in. But these are all of the list of things that are decided at the ACIP vaccine meeting. You have things on anthrax, cholera, COVID-19, dengue, hepatitis A, hepatitis B, HPV. You have the meningococcal virus, you have measles, mumps, rubella, and varicella, the MMR. You have polio, rabies, rotavirus, typhoid, etc. You have all of these other things that are also discussed, and they're looking at current data, talking to experts in the field, and they're trying to come to conclusions about this. So this is what they're stopping by canceling these meetings for the interim, for the immediate future. And then you might be thinking, oh, well, a postponement, that's not too bad. That's just like saying like, oh, we need time to get ready and like look at things. Well, no, the reason why this is bad is because the ACIP committee is a critical function on setting these vaccine schedules. So if you postpone this committee, what the committee does is they make recommendations, they send it to the CDC director signs it, and then it becomes pushed out as a federal guideline to all of the states. So if you pause this committee, if you effectively stifle them from being able to do their job, then no vaccine updates can happen. The government can't set these new standards, set these new vaccination schedules, etc. Nothing can change. Nothing can be updated. And that's what happened. This is sort of like a really critical committee, and if you don't have them doing anything, then the CDC director is not going to be updating vaccine schedules, and then you don't have the ability to like get vaccinated with new updated vaccines. It's an effective stop measure. If you don't have this, you can't get the new vaccine. Now, why does this matter? Well, the NIH is an institute that actually funds out to researchers at universities. It gives them grant funding. So what people do in research is they apply for grants. One of them is NIH. There's like the National Institute of Health. There's the DoD. There's the NIJ, the National Institutes for Justice. These are all things that you can apply for funding for. When I was in research, I got funding through all three of those institutions. So these are things that you can get money from because they have a big money pool, and you can say like, hey, this is how I'm going to benefit health. This is how I'm going to benefit defense. This is how I'm going to benefit having the justice system have progress in the field. So researchers will apply for this money so that those agencies don't have to do the research themselves, since people are already doing it at universities, and then that's a big funding pool. So for instance, in this article, it's saying that the NIH currently funds 4,400 active projects totaling $2.5 billion in Texas alone. And for research labs and for universities too, this is major, because what a university does, once you get awarded a grant from one of these institutions, the research university will actually take off 45 to 50% of the funds off the top. So you're actually only getting about half of that money to utilize for yourself. The university takes that money and puts it back into itself. And then for the rest of that money, you're allocating it to having grad students and undergrad students and postdoc students in your lab, and funding your own salary, and then funding supplies for your research, and then doing the research itself. So paying for the research to be done and having the tools to do it, and then applying to the journals and paying for those types of things, flying out to conferences to give your presentation talks and your abstracts so people know what you're doing in your lab. This is all where that funding largely comes from. And one of the very interesting things about social media is that we can see people's reactions in real time. So for instance, Michael Grushko here, who is really just reiterating what I already told you, but the part that I want to emphasize here is that the Trump NIH is essentially proposing a 50 to 70% cut to grants. So if they're making this cut, it's going to reduce the amount of money that's for the lab itself to be utilized for students, for faculty, for supplies, and actually just paying for keeping the building lights on and things like that, and running the machines, and having technicians too. So this is going to result in a reduction in lab sizes. There's going to be less opportunity for undergraduates and for graduate students to be paid by a grant to work predominantly on that grant for a specific research project on a specific topic. So it's going to reduce opportunity. That means a lot of these research students, these research assistants, are going to have to probably be teaching assistants, which is going to take up a lot of their time. There could be the chance that, well, they just don't have funding in the lab, so they literally can't take on students, so they'd have to basically do it for free. They'd have to do their graduate program for free, which means that they're also going to be paying their tuition. Because if you get a teaching assistantship, if you get a grant that you're working on, you're paid through that grant. That's also giving you a tuition waiver. And if you don't have these, then you have to pay for graduate school out of pocket. And that's very, very costly and very expensive. And if we don't have these grants, that means there's going to be a huge opportunity cost to all of these individuals. And if we scroll down even more, we have other examples too. So this person, Taro Kutinen, is saying that the overhead will be cut by about 75% in many cases. And this covers things like oxygen and nitrogen deliveries, the covering of animal facilities. So if you're running animal experiments with like rabbits or monkeys or mice or rats, things of that nature, you actually have to house them in a very specific way. And there are facilities on campus that you can use and utilize that has technicians and veterinary staff that comes in and monitors the animals daily so that you can make sure that they're eating ad libitum. Any adverse things are caught very quickly and can be resolved before the animal passes. Things like that. Human trials support toxic waste removal. That's a big one. So when you do any type of autopsy, or you're doing something that would have like human tissue waste or animal tissue waste, you have to put it through incineration. So you have to have a specific waste removal process. And if you're a chemical scientist or someone that works in biochemistry, even like biomedical engineers and things like that, you're going to work with a lot of chemicals, and you have to have chemical disposal services and then like sharps disposal and things like that. And that's going to cut into the budget for those things as well. And this is a pretty good summary of everything I've just explained to you. So by doing this and trying to save money, it's ultimately going to result in lights in labs nationwide literally going out, because either they can't afford the electricity cost, or due to the fact that they just can't afford to sustain a lab anymore. And researchers and staff will lose their job. And this includes young researchers and young staff. So this is going to be, again, the undergraduate students who would normally have be paid for working there. You would have the graduate students who would get the tuition waivers and would be paid on a grant. You would have the postdocs that are going to be working up to get a tenure faculty position. This is all going to be impacted by these cuts. So ultimately, altogether, I would call this an attack on our public health sector. There is defunding, there is delegitimizing, there is obstruction of processes with like the ACIP committee postponement, which has huge long-lasting impacts, because I'm assuming what's going to happen is that they're going to continue postponing. And when they do that, as these new vaccines are coming out, if you don't have the scheduling set who can receive these set for the new vaccines, then people just won't be able to get the new vaccines. And that's going to be a problem, because once the new vaccine is made available, the old vaccine becomes discontinued. So if you have a discontinued vaccine that people can no longer give, despite it still being like perfectly usable and able to use, you have a situation where people just can't get vaccines. And that seems to be the direction they're going, is that they're trying to play into policy to make it so that we can't have continued research, we can't discover new things, that everything is probably going to be pushed out into the private sector. It's really going to be a huge crashing turmoil within the scientific community for the public health sector within the coming months, where this is just the beginning. I can't find who said it, but they said that this was only phase one.